we have lost some of the nutrients, most of the nutrients that food was intended to provide for us. I remember a lady coming to see me with really bad breast cancer, and she sat down looking very fidgety. Her whole body language said to me, this is somebody who, you know, would want to be anywhere other than the doctor's office because she was so afraid. And her sister sat in the background with her. And, you know, did the usual with opening prayer, asked her to tell me a little bit about herself. And I noticed that she was being very cagey and not sharing a lot about her personal life. And of course, I'm praying while she's talking to me, and I sense God saying, hey, ask her about what's happening at home. And I say, you know, God, this lady really needs some treatment really quick. I don't know how much time I can spend asking her that. And he said, no, ask. So I said, ma'am, would you mind sharing with me what your home life is like? And I saw her sister in the background say, yes, ask her that, ask her that. And she said, Doc, I don't want to talk about it, but I'll share this. Every night when I'm going to sleep, I'm so scared because the last thing my husband says to me before I go to sleep is that he's going to kill me. And I said, wow, I cannot even imagine what that must be like. How long has this been going on? And she said, you know, about 3 months now. We've been having a lot of disagreements, and he's become really violent and so on. And what I had to do for that lady was to say, listen, let's take the breast cancer discussion off the table for a bit. Let's try and get your emotions, your soul, and your spirit into a better place. I said, I'm going to tell you this as a man myself. Do you have any brothers? She said, yes. I said, okay, are they adults? I said, yes. I said, do any of them carry a firearm? And she said, yes. And I said, okay, here's the plan. We're going to finish this discussion for today. You're going to go home and call your brothers, and you're going to ask them to come with a moving truck and make sure that they have their firearms with them. Choose a day when you know your husband is not going to be there, and let's get you out of that house. Pack up all your clothes, put them in a moving truck, and you go back and live with your family. Because that is not a healthy place for you to be, whether you were suffering from breast cancer or anything else. And I will see you back in 2 weeks, and at that time we can talk about the breast cancer.
Mm-hmm.
Now, the truth is, most people, Pat, go to the doctor expecting a prescription. They're expecting a solution. They're expecting a fix. So it has required me to have a lot more of a backbone, because you know they're going to go home and somebody's going to say, so what did the doctor give you? Nothing.
Right.
And she went home and she thought about it, and I didn't hear from her. 2 weeks later, I saw this lady walk back in, bright smile on her face, looking like dressed to the nines, and I mean her whole body language and everything. She had on a little bit of makeup now, and she looked so good. Her sister came with her, and she sat down and had a bright smile. She said, Doc, I did exactly what you said. I moved back in with my brothers and at my parents' home, and my whole body and everything just feels so much better. Anything you want me to do to get better now, I will do it. And I was able to have a better discussion with her at that time about her disease. She was very open. And she said, yeah, you know, I do recognize that I am somebody who's going to need chemotherapy, and I'm willing to do it. And I sent her off to the hospital, and she had such a great time. Now, imagine somebody going to do chemotherapy treatment, which is supposed to be devastating, and saying that they're enjoying the whole process. And that has been my experience with the patients who I still send sometimes to do chemotherapy if they really need it. I find that when we can find the root of the problem, which in some cases is emotional, and we can start to alleviate some of that emotional pressure that they're under, then it frees the body to start regulating so much better, so that even if they have to go through rigorous treatment, I've found that many of them experience little to no side effects from the chemotherapy, and they kind of just coast straight through the courses, and they come out on the other end fine.
Mm-hmm. And what a revelation that our emotions do affect our health.
Yeah.
And to date, cancer seems to have become a pandemic.
Yeah.
every other body, as we
Yeah.
could say in Jamaica, every
Yeah.
other person seem to be experiencing some amount of cancer.
Yeah.
Um, what do you think could be the cause of that? I mean, people are wondering what's happening, what's going
Yeah.
on.
Yeah. Yeah. So, fundamentally, I think cancer is just the end result of the body being unable to regulate its way out of a series of different obstacles. So I generally refer to, you remember those old time scales that would have two balance on either
Yes,
side?
yes,
And
balance.
the
Yes.
body does that endlessly. So right now, you and I are making constant adjustments. So if the temperature in the room changes, if we turn off the AC, for example, our body eventually is going to start sweating.
Mm-hmm.
We don't press a button to start sweating. Our body senses that the temperature has changed and it immediately adjusts. Now imagine if something goes wrong with that regulatory system and your body does not get the right signal. You're sitting in a room that's boiling like an oven and your body does not turn on the sweat glands or start to sweat, then that sets you up for problems. And that's a simple way of describing what cancer really is. It's ultimately just something has stopped the body from responding in the right way, and it has gotten stuck in this dis-ease state that we call cancer. Now, if we simplify it that way and we combine it with the verse that I shared earlier, then it's a simple matter to understand why cancer has become so much more prevalent. As humans, we are faced with so many more challenges on a daily basis, physical, emotional, and otherwise. Our food has become a lot more processed over the years because of our attempt to make food more readily available and accessible and easy to prepare. We have lost some of the nutrients, most of the nutrients that food was intended to provide for us. And similarly, we have become a lot more detached from each other socially, and our interactions with other people oftentimes I mean, look at us right now. We're benefiting from the technology, but this
Right.
conversation could be even better if we're in the same room, eh?
Mm-hmm.
So our fast-paced life as a society, as a population, a global population, our fast-paced food, the fact that most people, myself and yourself probably included, are willing to spend so much more time at work in an attempt to facilitate the kind of comfortable lifestyle that we're looking for. But at the same time, sometimes we work so hard that we never get the chance to experience that comfort or that vacation or that luxury that we're chasing after. And so you'll find that the alternative medicine practitioners, most of what they preach is diet,
Mm-hmm.
improving the diet, putting away cell phones, that kind of a thing. And whether or not they are medically trained, those approaches are generally going to make the human body healthier. If you spend
Mm-hmm.
more time in nature, spend less time on the phone, spend more time preparing your food slowly instead of just fast cooking it, your body is going to respond appropriately. And I think one of the basic principles of getting cancer numbers back down is making simple adjustments to understanding how the body was meant to 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 function. We look at the pandemic that we just came out of, and my personal opinion is, putting aside all the physical problems that the virus has caused, it also proved to be a challenge for many people who were used to being around their relatives and friends regularly.
Mm-hmm.
And one of the greatest casualties of this pandemic has been the emotional and mental health issues that have come out of it. And
Mm-hmm.
unfortunately, as I shared earlier, if that's not addressed in a meaningful way, if we continue to detach ourselves from interacting face to face, the body is going to
Mm-hmm.
respond inappropriately.
And that's profound, extremely profound.
Yeah.
The isolation,
Yep.
especially the younger generation,
Yeah.
on their phones, no
Yeah.
conversation. I've been to restaurants and seen an entire family having dinner.
Yep.
Everybody's on their phone.
Yep. Yep.
Nobody's having a conversation.
Indeed. Indeed.
Yeah. Tell me, Dr. Williams, what is your most rewarding experience as a medical person, as a
Uh,
medical doctor?
Most rewarding. So there's several, but I think there's a young lady who I know is gonna watch this podcast at some point. She came to see me at the end of 2019, a few months before the pandemic started. At the time when she came to see me, she had stage 4 colon cancer. She had gone through surgery, every treatment you could contemplate. She had already been exposed to. And she was at that point where she said, listen, if I have to take one more treatment of chemotherapy, I'm just going to give up. And somebody told her to reach out to me. And I actually had to meet with her on Zoom. And I said, hey, let's talk. And we did the usual, we went through everything. She told me about her diagnosis. And I said, what's happening with her home life? And she shared some things with me that